certificate versus certification. There's some confusion about the term certificate and certification, so it's crucial to distinguish between them. A certificate is a document provided by a school, trainer, or educational institution upon finishing an interpreting course, often referred to as Certificate of Completion or Certificate of Training. It signifies the successful conclusion of a training program. Therefore, it's important to note that a Certificate of Completion acknowledges your training but does not grant you any official credential, license, or certification. Essentially, it indicates that you've undergone training and that you may be qualified to interpret, but it does not certify your ability to competently perform the role of a medical interpreter. On the other hand, certification is the official recognition granted upon fulfilling prerequisites in successfully passing the national certification exams. This process is conducted by an independent organization rather than the educational institution you attended. The certifying body will initially assess if you meet the necessary criteria for becoming an interpreter and subsequently evaluate your knowledge and skills through rigorous exams. Upon successful completion of these assessments, you will earn certification, officially becoming a certified interpreter. Please exercise caution when reading and using these two terms as they have different meanings. They are not synonymous. Just remember that after completing a training program, you will receive a certificate of completion, not a certification. Certification requires additional steps beyond receiving a certificate from a school. It involves submitting an application to a certifying organization and successfully passing their exams. With that said, having a certificate of completion from a school is crucial in the certification process. The national certifying organizations require a minimum of 40 hours of training as a medical interpreter to be eligible for the exam. In other words, your first step towards certification is training. To sit for the national exam, you must present proof of training as a medical interpreter, which comes in the form of your certificate of completion. This requirement is applicable to anyone, whether you're a doctor, nurse, medical assistant, or an experienced interpreter. Anyone aspiring to take the certification exam must provide evidence of having completed the required training. Additionally, a certificate of completion alone may be sufficient to secure a job as a medical interpreter. Many companies are willing to hire interpreters with a certificate of completion. Others will hire you with the condition that you take the exams and obtain the national certification. And others will only hire you if you are already nationally certified. Therefore, having a certificate of completion holds significant importance as it is the first step into the medical interpreting profession. I hope you found this information helpful. See you in the next video. This was David for MITS.